The beauty of a phaco surgery doesn't begin at the incision. It begins in preparation. Assalamu alaikum. Hello everyone. I'm Dr. Jinia Hasan JC. Today I'll be sharing some very important topic but often overlooked. The planning and preparation of surgery, focusing on phacoemulsification surgery. Why preparation matters? They say failing to prepare is preparing to fail. In phaco, that couldn't be more true. The preparation determines how confidently we handle challenges, whether it's a dense cataract, a small pupil, or a restless patient. So, to know the plan, you have to know your patient. Our planning starts in the clinic. We assess visual potential, corneal clarity, intraocular pressure, dilatation, fundus. Equally important is understanding the patient. Diabetes, hypertension, if he or she is in using anticoagulants, alpha blockers, or any structural deformity like kyphosis, head tremor, Parkinsonism, should all be evaluated meticulously. Preoperative investigations like blood sugar, ECG, SPT is also important. Informed consent and patient counseling is another very important thing. Also, you have to know the occupation of the patient and what the patient wants. Shaky regular computer user or shaky চশমা use করতে চায় কিনা after surgery, we all these things should lead to choosing the correct IOL and technique also. This is a preoperative paper from Bangladesh I Trust Hospital. Here we can see the lens grading, the intraocular pressure, fundus, and there, if there is any medical history or past ocular history, all things were checked very thoroughly. And it's a paper of biometry with IOL master. Here we saw the axial length, the anterior chamber depth, the lens thickness, K1, K2 reading also. These are the things, these numbers quietly guide us towards the right IOL and technique. You have to prep the eye also. You can use topical antibiotics 1 to 3 days before NSAIDs to minimize inflammation, mydriatics, and discontinuing contact lenses before investigations. These are all parts of the preparation. Now comes the most overlooked part, preparing ourselves. We focus on the patient but forget that our body and mind are part of the surgical instrument. So, a good night's sleep, a healthy, good breakfast, staying hydrated, all are part of preparation. And we should always remind ourselves to review our case and mentally walk through the case before scrubbing in and be ready with backup techniques. The personal preparation is also very important. Proper scrubbing, gowning, gloving, and maintaining an aseptic discipline is a must. We have to spend at least 5 to 7 minutes scrubbing properly. The draping also matters. It gives a well visualization along with a sterile operating film. So, to know proper draping technique is mandatory for every surgeon. Now comes the ergonomic setup of the operation, like the chair, the table, the foot pedals, and the microscope. All the chair should be very adjustable. It should have a proper back support, and some of the chairs does have elbow rest, which are very useful. And we have to keep the table in a position that is comfortable for the surgeon, and the leg should be in 90 to 110 degree alignment to the floor, and the table should not touch and make uncomfortable the surgeon. The patient table can also be inclined or declined. By this, we can make the eyeball in center position. And now comes a very important topic, one of the most important thing that we should maintain always. So look at these two pictures. What do you see? Do you think this surgeon is maintaining a correct posture? Let's see. I don't think her back is maintaining the proper normal vertebral curvature, right? So these positions are not good for her or any surgeon. The first picture where she is looking up very high to reach the eyepiece, it will give her neck pain. And in the second picture, she is leaning way too low to see the eyepiece of the microscope. It will give her back pain for rest of the life. So are you willing to give your physical health? We shouldn't do this, right? So this is a mm, somehow posture perfect position for a temporal approach, phacoemulsification. Yes, we can always also do superior approach, but the posture should be like this. See, it is quite maintaining the normal vertebral curvature, and the arms should be in 90-degree. So this is a proper position, proper surgeon's position for a phacoemulsification surgery. And sometimes a few minutes stretching between surgeries and taking a deep breath also when you have a long list of surgeries are helpful. You should have break, you should have some snacks and coffee also. So I like to think of surgery as an orchestra. When every instrument is tuned in advance, the performance becomes effortless, right? So the machine calibrated, tubing flashed, viscoelastics checked, microscope and chair adjusted, small details, but they define comfort and flow. So once we enter the OT, the stage must already be set. And a well balancing microscope is a must for phacoemulsification surgery because it is a very fine and delicate surgery. So every instrument should have flexibility, as much flexibility as possible. এখানে দেখা যাচ্ছে যে আমরা আইপিসটাকে টিল্ট করতে পারি, টিল্ট করে উই ক্যান অ্যালাইন ইট with our height and our eye position. And দুই ধরনের বাইনোকুলার পাওয়া যায়, একটা হচ্ছে ফিক্সড টু 45 ডিগ্রি and আরেকটা হচ্ছে we can tilt it from 45 to 90 degree. And the microscope should be brought at first to at the level of the eyepiece of the surgeon. So the what will be the series, what will be the serial? আমরা ফার্স্টে বসবো, দেন আমরা আমাদের মাইক্রোস্কোপটা টেনে এনে আইপিসটা আমাদের চোখের সাথে অ্যালাইনমেন্টটা ঠিক করব. Then we will fix the table position, and we can adjust the chair height also, and then we are set to start. Then another thing is we can set the refractive status in the eyepiece also. Eyepiece setting is also important. এটা জিরোর সাথে জিরো মেলাতে হবে, এবং if we have a spherical power, not the astigmatism, if we have spherical power we can adjust it to যদি আমরা চশমা ইউজ না করতে চাই এখানে আমরা অ্যাডজাস্ট করে নিতে পারি। অ্যান্ড অলসো সাম ইয়াং সার্জনস এটাকে একটু হাইপারমেট্রোপিক করে রাখে টু relax the accommodation, and IPD setting is very very important. আমাদের আইপিডি জানাটা খুবই জরুরি। আমাদের আইপিডি না জানলেও আমরা শুরু করতে পারি ফ্রম লার্জ টু আস্তে আস্তে আমরা আমাদের পারফেক্ট আইপিডি পজিশনে আনতে পারি। অ্যাজ binocular single vision is very important for fine surgeries like phacoemulsification. ইভেন আমি আমার আগে চশমা ইউজ করতাম না, যখন আমি ফেকো শেখা স্টার্ট করি, then I checked my refraction and what a surprise, I found that I have a little myopic astigmatism, but when I corrected my refractive error, it was very it improved my surgical skills, especially in the rexis and the sculpting when we have to look at the depth of the nucleus. আমাদের যখন ডেপথটাকে ভালো করে পারসিভ করা লাগে, we have to have a proper refractive status and a perfect binocular single vision. We can also change the illumination of the microscope, and when we have in some soft cases retroillumination is very helpful for doing rexis. Team briefing is also very important. Every eye tells a different story and planning must be tailored according to the case. So for a hard cataract, I keep extra viscoelastics and prepare for divide and conquer. So we can share the anticipated challenges and the planning and techniques with your colleagues. Always make a plan and then start the surgery. What you can do in special situations. For a hard brown cataract, I keep extra OVDs and prepare for divide and conquer or direct chop. I have small pupil, so hooks or the pupil expanders must be ready. Pseudoexfoliation, CTR and capsular hooks on standby, and if the posterior capsule looks fragile, I reduce phaco power and switch to safer settings. So good planning turns challenges into routines. And anesthesia is also a very important part of surgery, all surgery. We usually use the retrobulbar block or topical anesthesia, and we should ensure patient comfort and cooperation during anesthesia. So preparation over time becomes an art. We start recognizing patterns, the way the nucleus behaves, how the patient's anatomy feels. So to conclude, preparation transforms phaco from a procedure into a performance. So plan your steps, visualize your surgery, and respect small details. Because when you plan well, every case becomes smooth, every complication manageable, and every outcome satisfying. Thank you all.